Welcome back. As Omicron cases around the globe and in the U.S. continue to surge, we have threats of lockdowns in various parts of the globe. And for all of things COVID, we want to bring into the stream right now, Murtaza Akhter, emergency physician at the University of Arizona College of Medicine in Phoenix. And doctor, thank you for joining us here. I guess the question on everybody's mind here, we know that the cases are surging. They don't seem to be as damaging to human health as the Delta variant. But nevertheless, a lot of lockdown measures are in place around the world, and companies and sporting events are finding alternative means to deal with these setbacks. So what's your ground level view on the COVID situation right now?
Yeah, Jared. Well, it's one of those things where South Africa was very proactive in trying to sequence genomes and letting the world know about the variant. And it hasn't quite hit as badly in the southern states as it has in the Northeast. Arizona is seeing a little bit of a spike. Miami, another place I work, hasn't seen much of one at all. But as you know, the variant spreads before it's detected, and it's being detected at such a rapid rate in terms of its increase that it's a matter of time before it supersedes Delta. As you mentioned, it does seem to be less severe. We don't have the full data on that. So it could almost be, I hate to say it, but it's sort of ironic. It could almost be a good thing if it outcompetes Delta, if it really is less severe. But we don't know that for sure. We do know for sure it's very transmissible. And so there definitely will be an increase in cases.
And doctor, even though it may be milder, that doesn't mean that there are less people that are coming into the hospital, because sometimes there are complications. They come in to get tested. And, isn't there a false of security in sort of assuming that it could be milder, because it still puts such a huge pressure on the healthcare system, which is already strained at the moment?
Yeah, I definitely am not suggesting that people should take it easy because it might be milder. For one, we don't know for sure that it is. And even if it were, it's so transmissible that the amount of people who will be infected will be far higher, of which a significant amount will be sick enough to need hospitalization. So if you get a milder form of anything, if you have so much of it, you'll ultimately have bad outcomes, whether you're talking about coronavirus or really anything in life. Even if you get a less severe version, but you have many more of that version, obviously there are going to be worse outcomes. And so people still need to stay vigilant because even if any individual with that variant may be less likely to be severe, and we don't know that for sure, the amount of individuals who will have the disease is going to be very, very high, especially after the holiday spike. That holiday spike was going to happen regardless. We know people are going to mingle. But then you add to that the very transmissible Omicron variant, and you'll have a huge spike in January.
And then what is the solution? How do we deal with this? And especially with respect to the role of boosters, because we got some data the other day from South Africa, where the J&J booster wasn't necessarily effective in preventing transmission, but perhaps it did reduce the rate of hospitalization and the side effects being less severe. Are the booster shots, and not only the J&J one, but also the Pfizer and the Moderna one, are those potential solutions to curb the transmission rate?
Yeah, the boosters, at least the preliminary data that we have so far, the boosters do seem to be quite effective at helping prevent contraction and therefore transmission of the Omicron variant. We still need more data on that. But we do know that people who've had 3 shots compared to 2 seem to be much less likely to contract the Omicron variant, whichever booster you're talking about, but in particular, the mRNA ones, which are by far the most common in the United States. And so that is one effective strategy of preventing contracting the disease, as well as therefore transmitting it, of course. Of course, there are all the other measures that we've talked about for now years. It's unfortunate to say that, but that includes masking, ventilation, and distancing. And so when cases are rising, you have to be more vigilant. And it's unfortunately become one of those things where we didn't stamp out the disease when we had the opportunity. So now it's with us, and it's going to be a matter of every once in a while having to have those measures again, as you're seeing in other parts of the country and in other sports venues, as you mentioned earlier.
There are some experts that are being slightly optimistic and saying that COVID could stop being a pandemic as early as next year. What's your take on that? Is that too early? And then if it does become an endemic, what does that look like? Do we get to stop wearing masks, or what does that look like to you?
Yeah, so that's a great question. And it kind of ties in with what we were talking about. If Omicron or any variant is less severe, could it become a situation where if you take the amount of vaccinated people there are and the amount of infected people there are with mild infection and you add them up, that you have a certain level of tolerability to the virus because so many people have developed antibodies? It is a very distinct possibility. And Dr. Fauci himself published a paper over a decade ago saying that we're actually still in the era of the 1918 flu pandemic. And all the H1N1s that we've had since then have been descendants of that flu. Obviously, the Spanish flu killed a ton of people, 50 million. I shouldn't say Spanish flu is probably not politically correct because it didn't necessarily start in Spain. It just got that misnomer. But that flu never really went away. It got a lot less severe. And the surges we've had in various years, including 2009, were actually descendants of that disease. And so it's very possible that COVID does the same thing, where we now have to, quote unquote, live with it. Very unfortunate, but it's probably going to be true. But that in future variations, 2022 may be a bit optimistic, but not completely unreasonable. But in future years, that even though we have COVID, it'll be much more like the flu in terms of its being less severe. Now, remember, flu still kills a lot of people. A lot of people die of the flu. That's why hospitals have surges in the winter, even before this pandemic. But that it won't be as bad as it was when we first got hit with it, that the SARS 2019 novel coronavirus 2 won't be quite as novel, and that in the population it will be less severe, such that it becomes, as you said, more of an endemic.
Pretty profound to think that we're 103 years into an existing pandemic. Doctor, we have to leave it there, but we appreciate your time. Dr. Murtaza Akhter, emergency physician at the University of Arizona College of Medicine at Phoenix.